In an interview with Barbara Walters, Richard Nixon was asked how he would like to be remembered. His answer surprised many.
How would you like to be remembered?
We all think of, well, he went to China. He ended the war in Vietnam. He opened relations with the Soviet Union through détente. But in my view, if the cancer initiative, which we began, could save lives, that'd be worth all the rest put together.
At the signing ceremony of the National Cancer Act of 1971, President Nixon's remarks were those of hope. He said, "For this legislation, perhaps more than any legislation I have signed as President of the United States, can mean new hope and comfort in the years ahead for millions of people in this country and around the world." 53 years later, the Richard Nixon Foundation has continued to support President Nixon's vision of hope. The third annual Nixon National Cancer Conference took place at the Richard Nixon Presidential Library and Museum in Yorba Linda, California, on January 17th and 18th, 2024. More than 400 distinguished cancer center directors, executives, scientists, researchers, experts, academics, authors, journalists, political and public officials, philosophers, ethicists, and activists gathered to hear from our esteemed panelists. This conference, which highlighted a range of vital aspects of cancer research, treatment, and care, was all possible through the support of our donors: City of Hope Orange County, Hoag Family Cancer Institute, UCI Health, the Arnold and Mabel Beckman Foundation, the University of Texas MD Anderson Cancer Center, Chalk Children's Hospital, and F&M Bank Foundation.
The National Cancer Act for this country has truly transformed our priorities and recognized in a very prescient way where the future was going to be. I'm in oncology because of it. We know that cancer is an epidemic. It's the war that we've been fighting continuously for the last 50 years, and we'll continue to fight it for the next 50 years. And I think the Cancer Act really empowered all of us to look forward, look for innovation, and really have a cause to rally around to try and help something that affects millions of people, including our loved ones. And so not only is it a profession, but it's also a personal passion that we all exist to really be part of that battle.
You could use currently available technology like NLP, natural language processing, to capture the dialogue between the patient and the doctor, the questions and the answers, the discussion of the therapy, the risks. That could all be exported into a large language model and moved into Epic in a compliant node that then requires light touch editing by a clinician. If we could climb that mountain, we could transform clinical medicine from what it is today to what it could be in the future.
We all talk about patient as a whole, and we're trying to help them. We do all this research. We spend billions of dollars on trying to treat patients. But what if we can detect it early? We talk about pancreatic cancer. We normally see them in a later stage. How could we have early detection if we have an early detection algorithm? That's what I call it, algorithm, not one single blood test, not only genetic testing, not putting family history together. We want to have an algorithm that put all the information together and tell us this patient needs to be monitored this way. And then we can detect pancreatic cancer early. So we can do the surgery and have a better 5-year overall survival or 10-year survival for these patients, comparing to when we actually detect the cancer is too late.
We should be telling our patients what to expect, right? That there's in all likelihood, there's going to be a letdown. There's going to be uncertainty. And, if you have questions, call us, send us a my chart, right? If we need to bring you back in, we'll bring you back in, right? Because it is hard to sort of go from 100 miles to 20 miles an hour, right? It feels that way. And going back to sort of the theme of all of this, communication is really, really important. And being proactive with our patients is the best way to get them through this journey in a smooth way.
Thank you for the extraordinary efforts that all of you have already demonstrated, as well as all your colleagues. President Nixon, thank you for your vision that allows those of us in this room and around the world to provide hope where there was no hope.